The Centers for Disease Control and Prevention (CDC) reports prostate cancer was the second most common cancer among men in 2019. Benign prostatic hyperplasia (BPH) affects about half of all men between ages 51 to 60. Yale Medicine explains. That percentage increases to 80% for men ages 70 and older. Prostate gland health can be influenced by a wide variety of factors. Some of the clearest risk factors listed by the American Cancer Society fall cannot be easily changed or changed at all. These include age, geography, and family history. However, other risk factors that are less understood but known to have a relationship to prostate cancer can be addressed. These include diet, obesity, and chemical exposure. The prostate is a small gland that is instrumental in reproductive functioning in men. When healthy, it is donut-shaped and wrapped around the urethra, the tube through which men urinate. This is why an enlarged prostate makes urination difficult. And there is no doubt that diet plays a crucial role in both prostate health and minimization of symptoms in those with prostate disease. In this video, we take a look at some of the foods to avoid to have healthy prostate. 1. Beef. The World Health Organization who classifies red meat as probably carcinogenic to humans. It also explains that there are links, although not a conclusive connection, between eating red meat and prostate cancer. A recent systematic research review published in the journal Frontiers in Nutrition found an important connection. Specifically, a connection between increased meat consumption and increased prostate cancer risk. Beef is the most popular red meat among Americans. It's also the second most popular animal protein eaten in the U.S., behind chicken. Reducing beef consumption may help to lower prostate cancer risk. 2. Dairy. The saturated fats in most dairy make it problematic to prostate health. Dairy tends to undermine the overall low-fat diet that is best for prostate health. It's important to note that dairy includes milk, hard cheeses, and ice cream as opposed to all dairy products. So get your calcium from salmon, greens, and almonds instead of dairy. 3. Non-organic chicken. Factory farmed chickens are tainted with hormones, antibiotics, and steroids that affect the growth of the animal and the substance of its meat. When birds ingest foods they are not evolved to digest, digestion creates toxins as tissue is grown to 200 to 300% of their normal size. Chicken contains heterocyclic amines, which have been shown to induce prostate cancer in rats and damage DNA in cultured human prostate tissue. 4. Pork is sometimes thought of as white meat. However, the U.S. Department of Agriculture explains that it is in fact red meat. That's an important distinction when it comes to prostate health, especially because pork is such a popular food. Reducing pork in your diet could help to reduce the risk of prostate cancer. 5. Alcohol. Alcohol is another substance that increases the urge to urinate, resulting in a frequent and urgent need to urinate. This dehydrating effect can irritate both the bladder and the prostate. 6. Saturated fats in any food. Saturated fats have very few advantages and are already highly correlated with heart disease. But emerging research shows that they're not very good for your prostate either. These studies have shown a connection between saturated fat intake and the risk of prostate cancer. Saturated fat is primarily present in butter, coconut oil, or palm oil, sausages, bacon, fatty meat, pastries, cheese. 7. Processed meat. Processed meat is a broad category. It covers a variety of animal proteins that are somehow modified to improve taste or reduce spoiling. Hot dogs, lunch meats, and sausages are a few examples. 8. Spicy and acidic foods. Because they tend to inflame the bladder and prostate, spicy and acidic foods increase primary urinary symptoms in men with diminished prostate health. Thus, aim to eat less curry, chili, and hot sauce. 9. Caffeine. Caffeine acts as a diuretic, meaning that it dehydrates you by increasing your urge to urinate. It can be challenging for enlarged prostate sufferers to empty the bladder, resulting in discomfort. To relieve this symptom, reduce your caffeine intake, including coffee, tea, and soft drinks. At the end, understanding changeable risk factors related to prostate health can help you make healthier decisions. You can avoid the worst foods for prostate health mentioned